Good evening. I am Dr. Anoop Varma. I am a consultant neurosurgeon working in Thodupuzha, Kerala. I am going to speak to you about the importance of diet, lifestyle modifications, and need to adherence to the medications in a patient with epilepsy. Epilepsy, as we all know, we have to stick to the medications for a long period of time. So, with epilepsy, there are a lot of triggers which will initiate seizures. So, what are those triggers? The most important trigger is anxiety, decreased sleep, and some triggers include alcohol, cigarettes, and all sort of drugs that you take. And there are some medications which can trigger your seizures. So, regarding anxiety, to reduce your anxiety levels, we all know there are a lot of things that is available in the net regarding how to reduce your anxiety. The most important thing is regarding meditations or yoga. Or else, if you are not interested in all this, you can start a sport and stick to the sport. And for your calmness of your brain, you can have some creative things in your life like photography, videography, drawings, paintings. These are all will decrease your decrease your anxiety levels. Stick to one thing and be regular in all these things. So, along with reduce anxiety levels, sleep has got a very paramount importance to decrease seizure triggers. Getting a good sleep will always be helpful to reduce your anxiety levels also. So, reducing your caffeine intake at night or reducing your tea intake at night, avoiding usage of mobile phones for a long time in night, and be in your bed in your cozy. It should be in a cozy area of your house and be in your bed on time, sticking to your routine time of sleep. All will help us to have a good sleep, and it will all reduce the triggers for seizures. After these lifestyle modifications, the other important thing is regarding diet. Recently, the diet has got a very prominent role in all sort of diseases. Like you see diabetes, you take an example of hypertension, all sort of diseases. You see that there are the importance of diet has been to a next level now. So in patients with epilepsy, diet has got a very important role in epilepsy management also. All sort of diets that I'm going to speak about will decrease the seizure potentials once we stick to that. So what are the diets? The most important thing of all these diets that I'm going to speak about is low carbohydrate diets or low carbohydrate levels in the body. The most important and most studied about is the ketogenic diet. So what is ketogenic diet is to have very less amount of carbohydrates in intake per day. That is less than around 10% of the diet can only be carbohydrates. The rest should be fat, high quantity of fats and good quantity of proteins. Ketogenic diet, especially in it has been studied extensively in children, and it has been found to be very useful in children by decreasing the episodes and having a very long seizure free interval in kids. Along with ketogenic diet, the other diet which has been very much studied is Atkins diet. The other diets include medium chain triglyceride diets also. So all these diets, the carbohydrate intake has been very minimal. So sticking to any of these diets of your choice is very important and will be very helpful to have a prolonged seizure-free interval for you. Sticking to these diet is not that easy, but once you try, once you have a plan, once you stick to the plan, then it can work and it will create wonders for you. The other important thing is having nutritious things in your diet, like having good amount of folic acid, good amount of vitamin B12s, and all the other micronutrients like zinc, selenium, all sort of things in your diet. And you can take supplements for that, or some are mostly available in foods, and taking the food in adequate quantity will also be very useful for you to prevent to have a very balanced diet and to prevent further seizure episodes also. So first I told about reducing the anxiety levels, then I told about having a good sleep, then I told about sticking to a diet, sticking to good diet, healthy diet, avoiding all the bakery items, all the uh, hotel foods, and sticking to a good plan, regular plan, sticking to it will all be useful for you to have decreased seizure episodes, and thus having a good outcome or having a very healthy life for you. The other important thing is sticking to the medications. How we can have a prolonged medications how sticking to have medications in time, or adhering to the medications for a long time. How can we do that? So for that, you should always have a plan. Like, you have your breakfast, immediately the first thing that you should do is taking the medications. Most of the anti-epileptic medications are twice dosage, like it should be taken in the morning and in the evening. So immediately after the food, the first thing that you should do is take the medication. That is a very good way of sticking to this. Once you find that you have missed a morning dose, and you try to take the medication as early as possible once you remember it. And if it is very close to the next dose, try to take the dose as early as possible and avoid overdosage. Actually, overdosage is also very harmful for you. So sticking to the medications in time will always be helpful for you, and it will always have decreased seizure potentials. It will always help you to have a prolonged seizure free interval for you. What I want to say in the message is, stick to your plan, be regular, and be strong. This will all help you to have a prolonged seizure free interval, and have a very decreased chances of seizures in your life. Thank you.